Hello. So today we're going to talk about what family members should do if they have a person in their family that's positive for COVID-19 and how they can prevent themselves from becoming positive. And I know we've all kind of heard some things and what we should do and how we should isolate. I think this would be a good time to go back over some of those things with the fall and winter coming up, and also some things that the patient themselves can do to stay or to get healthier. So the first thing, if a family member is positive for COVID-19, we want to isolate them to one room in the house and make sure that they're in that room away from the other members of the family. That room should be well ventilated. It should have everything that the patient might need. Some reading material. I would recommend that they journal, something to write with, possibly a computer or a smartphone where they can FaceTime with the rest of the family should they need something. So the second thing is we really, as hard as it might be, we want to limit the patient's movement in the house. We really want to keep them confined to that one room to limit the spread of this COVID-19 virus that they may have at the time. Number three, we want to make sure that the rest of the home is well ventilated. In other words, doors open from time to time, windows open from time to time. If there's an air conditioner, that would be good. If there's any kind of air purifier or something that purifies the air so it catches different bacteria or viruses from the air. And so all of those things should be set in place to secure the rest of the home so we don't have to worry about, again, other members of the home becoming infected. I think that we should limit the contact with the person who is COVID-19 positive to one caregiver. So in other words, there will be one person that has no underlying conditions, pretty healthy person that would interact with the person that's being isolated, would give them their food, would give them water, would go in the room and check if they need to move around, if they need to go to the bathroom, those kinds of things. So that person would be the only person that would be in close contact with that person. And that person, as well as the patient, would always have a mask on, always have gloves on, and always constantly be sanitizing their hands. Okay, so those are the three things. And as far as the other family members go, we always want to remember that social distancing is very important. And of course, we're in the home where that's gonna, from a practical standpoint, that might be a little difficult. But we do want to try to keep it 3 to 6 feet of distancing between the patient and the rest of the family. Of course, the one caregiver is probably going to be a little bit, have a little bit more closer contact. And that person, again, should have the mask and also have a face shield on because they're going to be coming into close contact. There will be a link below that will talk about how you can make masks at home and also how you can make shields at home that will be appropriate in this setting. Hand hygiene is going to be very important. Before the caregiver that's taking care of the patient interacts with this patient, they should wash their hands before, they should wash their hands after. The next thing that we want to keep in our minds and be mindful of is that we have a person that's positive in the home, and we want to make sure that we don't infect the whole household. So we're talking about avoid touching our faces. That's really, really important. Washing hands, avoid touching your face, because if you should happen to come into contact with a droplet or touch a surface that has been touched by that person, of course the person is going to be in that room, so that's going to be a little bit difficult. But should that happen, we want to make sure that you're safe from contracting the virus. With that being said, there should be a daily cleaning of all common surfaces and common areas that where people are touching and moving around. And the way and what's been recommended by the CDC as well as WHO is that those surfaces should be cleaned first with soap and water, okay, just regular soap and water, and then secondly with a disinfectant. I'm also going to leave a link below that tells all the disinfectants that are good, and those disinfectants would contain about 0.5% of hypochlorite. And you can look in the link, and it'll tell you all the disinfectants. I believe there's over 100 that are appropriate in this setting. And so again, we want to wash off all common areas that are being touched, including the bathroom, the kitchen, and also the patient's room. Those areas too that are commonly touched, the bedside area, the bed areas of the bed that are exposed, like the frame, those areas should be washed down. When it comes to the linen, that the patient is sleeping with and sleeping on should be put in a bag, taken to the washing machine, washed, and then dried on temperature 60 to 90 degrees, and make sure that it's dry, very dry. No shaking out of the linen. Just dry it, put it back in a clean linen bag, take it to the room, put it back on the bed. And that, I would think that you would want to do that maybe every 2 to 3 days to make sure they have clean bedding. I wanted to go over those things because, again, we're coming up against the season where we're going to not only have COVID-19, we're going to have influenza A, influenza B, the common cold, allergies, and so we're probably gonna have some more positive cases. And so if you're that person that has a family member that's positive, we want you to know the appropriate things. Okay, so I want to go over a few things that I think will help the patient get better. Okay, so these are some things that we want to encourage the patient to do. Drink plenty of fluids, okay? That's always been said, drink plenty of water, but more important, drink water. The other thing is breathing is going to help you get better quicker. And the breathing would go something like this. So you're taking a deep breath in, holding it for 5 seconds, and then blowing out. Do that about 5 times. And the caregiver would do that with the patient. Deep breath, hold 5 seconds, blow out 5 times. That's going to expose the lower lung fields, which is going to help get the patient through this infection. Again, another thing, the patient, there's been studies that have shown that when patients lay on their stomach, that helps circulation in the lungs as opposed to laying on their back. So try to get the patient, maybe uncomfortable, but try to get the patient to lay on their stomach. You're going to be able to move more air, you're going to be able to access more of those lower lung fields if they're laying on the stomach. And then lastly, as tired as the patient might feel and exhausted and emotionally upside down as they may be, have them try to move around in the room as opposed to just laying in the bed. Moving around is going to be better for the patient and help them to get back to their normal quicker than them just laying in the bed. So if you like this video, click the like button, and if you want more information, subscribe to our channel.